McGraw.
All right, so quickly, what did President Obama do Thursday?
President Trump, you mean?
Excuse me, President Trump. I apologize.
He did two things. So
Yes.
one, he issued an executive order, which made asked the department to review some regulations around association health plans, short-term insurance, and health reimbursement accounts.
Okay.
We can talk more about that. And
Right.
then he also decided to stop the payments for insurance companies for the cost-sharing reductions that consumers are eligible for, which reduces their deductibles and their copays.
What should the person who is getting their health insurance in Missouri or Illinois on the exchanges, what should they be worried about and or concerned about, if anything, with these moves?
So one, for this year, there isn't a whole lot to worry about. Consumers should know that the marketplace is open on November 1st. The marketplaces are still here. Insurance is available. People should go and shop if they are interested. A lot of the insurance companies saw that they thought this may be happening, that
Right.
the president was going to end these cost sharing reductions. A lot of them took that into account. In Missouri, we saw the average marketplace premiums go up between 20 and 30%.
Okay.
So we really think they took this into account this year. We'll see another jump probably next year as more of them make adjustments.
A 20 to 30% jump. That's a big jump.
Significant.
That's really big.
It is really significant. Now, most people, 90% of people that use the marketplace are eligible for subsidies for the premiums. So consumers, depending on your income, feel this to a greater or lesser extent. The higher your income, the more you're going to feel these premium increases. The lower your income, the subsidies are going to cover most of the increase.
Oh, well, I see. So the closer you are to, so the people who are better off are going to get more of the 20 to 30% increase.
Yeah, both these executive orders really impact middle-income Missourians, Americans.
Right. What about the other things he did besides the subsidies?
So we're not going to see the impact of those probably until 2019 because he's sending them back to the department to review and write new rules and regulations. What he wants to do, what the president wants to do, is loosen up the requirements for like an association health plan. And what that is like real estate brokers, insurance brokers. They get their insurance through, a lot of them are independent.
Right.
So they group together and they buy insurance together. Now, there are some pretty strict rules about that. And so the president would like to loosen that up so that more people can create association health plans. Now, the issue with it is that a lot of the association health plans don't have to follow the rules of the Affordable Care Act, which means they can look at small employers based on pre-existing conditions and charge them more. They can charge more for women. They can have annual dollar amounts that they'll cap your insurance at. And the same thing with the short-term plan. So the president wants these insurers to be able to sell 3-month insurance plans. They're literally bare bones policies for healthy people.
Right.
If you actually get sick, that insurance is not going to do much for you.
I bought a 3-month plan when I was changing radio stations because I knew I was leaving one and going the other. I had no idea. I was like, wow, this is great. It was cheap.
Yeah.
And then I had no idea that it covered virtually nothing.
Right. And there's two concerns. One, people don't understand that it doesn't cover much. And two, it pulls the younger, healthier people and pulls them out of the marketplace or pulls them out of their insurance, which then just drives up the cost of people that stay in the marketplace because they want the comprehensive insurance, they want the protections. And that's the big concern is this sabotaging the Affordable Care Act, sabotaging the marketplace? Yes, it will make some younger, healthier people really happy.
Right.
They'll get cheap insurance, but it isn't very good insurance.
It's also, if it's 3-month insurance and God forbid you're diagnosed with something terrible, they can, after 3 months, they don't have to sell you that policy again.
Right. They can drop you. Absolutely. And the marketplace, there's only open enrollment, which now has shortened to 6 weeks. So it's November 1st through December 15th. So you buy a 3-month plan, it ends in March. You can't just go on the marketplace and purchase insurance.
What about, does any of this, association plans, pooling your people together to get a better deal, isn't that the definition of insurance?
Yeah.
I mean, I don't understand, right? You don't get any benefit by being an individual, but you're being put into a larger insurance pool with that company.
Yeah, and there is actually, I find association health insurance actually really interesting. And for like real estate brokers insurance, it's a really good thing because it allows these individuals to group together to purchase insurance. The problem is the same rules don't apply to association health plans as to other insurance. And so what happens is if you're a small employer and you're pooling with other small employers to buy one of these association health plans,
Right.
if your employees happen to be older, you may get denied from joining that association health plan, or you may have to pay a whole lot more. So they can charge, the association health plan can charge different small employers or individuals completely different amounts, and they can look at things like age and health status and gender.
Whereas KTRS, a small business, we get our insurance through the more traditional way. They can't deny us and or employees for all those things.
Right, because they are an ACA compliant plan.
They keep talking about, Ryan Barker, selling insurance plans across state lines, which sounds like a great idea. It doesn't make any sense to me.
It'll be interesting because, yeah, the president is sort of obsessed with this selling insurance across state lines. I don't think it's going to, from 15 years of researching this, I don't think it's going to do a whole lot. And then the problem is we hear a lot from conservatives that they want states to be able to make their own rules and states to be in control. But if you allow insurance to sell across state lines, you have to make sort of federal rules to regulate that, because Missouri has different insurance rules than Illinois. Whose rules apply if you're selling across state lines? Well, they're going to have to make a federal minimum and say, well, this is the rules you play by if you're crossing state lines.
Because eating disorders is covered in the state of Missouri, not in Illinois. So if you're in New York and you have a kid who has an eating disorder, can you buy a Missouri plan? Which doesn't make any sense because the Missouri doctors sign up in the Missouri plan, but yet you're in New York.
Right. And when the insurance companies start offering plans across state lines, which state rules do they play by? Well, they're probably going to want to play by the state that has the least restrictive rules.
Right.
Well, that's going to make the states that have more, extensive rules not very happy. And so that's what the feds are trying to figure out is where do we set that floor for what this insurance cross state lines looks like? And it is a lot more complicated for insurance companies to try to come up with provider networks if you have people purchasing in Iowa and Alabama. And do they have to have provider networks in both those states for that insurance plan?
Right. And then on top of it, let's assume every single person who has an eating disorder buys the Missouri plan. Then our rates aren't normal because they'll be skewed because we're accepting too many people outside of the traditional population.
Yeah, and this is partly why we haven't had this buying insurance across state lines, because it sounds good in theory. In practice, it's really hard to implement, and what rules do insurers have to play by? If you look at the statements from the insurance companies, from the Association of Health Insurers, they're not all that excited about this. They're not asking for it.
Ryan Barker, you were with the Missouri Foundation for Health, which is what? What is that?
We are a nonprofit foundation that we are a grant maker, a change maker. We help communities and especially focus on vulnerable and low-income Missourians that don't have health insurance.
You're also funded in part by insurance companies, are you not?
That's where we came from. So we don't have funding anymore. We came from a conversion of Blue Cross Blue Shield from for-profit to nonprofit, but we're completely separate from them now. We have the conversion money, and we give out about $50 million a year in grants.
We're hearing that insurance companies, doctors, hospitals, they all do not like what President Trump did this past weekend.
There is pretty universal agreement that the across the health system that this was not a good move. It's going to destabilize insurance. It's not great for consumers. It's going to further segment consumers into healthy populations and sick populations, and it's going to push more people to being uninsured.
Any good that came out of this?
Any good? That's a great question. I'm not sure. The good is I think people are talking about it. This is a complicated subject. Nobody really likes to talk about insurance, but it's really important that people understand this. And I hope it's bringing attention to the fact that the marketplaces are still here. The ACA is still the law of the land. And come November 1st, open enrollment starts, and people should check out healthcare.gov to figure out what their options are.
Does anything he did affect the traditional employer-employee health system, which most Missourians and Americans get their insurance from?
No.
Didn't affect it one way or the other?
No.
Which is interesting because there's two different types of insurance worlds. People who have jobs and people who are independent contractors and or self-employed and small businesses that don't offer insurance.
Right. And what President Trump did on Friday, really for 60% of Americans that get their insurance through a larger employer, it doesn't affect them at all.
Ryan Barker, you're always welcome here. Vice President of Health Policy with the Missouri Foundation for Health. Thanks.